We got a trauma one here. What's the most appropriate intervention for a patient with a suspected pelvic fracture and signs of shock? Would it be A, administer high flow oxygen, B, splint the pelvis with a sheet or commercial binder, C, place the patient in Trendelenburg position, or would it be D, perform a detailed neuro exam? Now, the problem with pelvic fractures is the amount of bleeding that can occur. Now, within the space of the pelvis itself, it can bleed over 2 liters. They even say 2 to 3 liters. This would put you into what they would consider a class 4 hemorrhage, which the patient will go into decompensated shock and can even bleed out. So, this is a huge issue. This patient needs surgery as soon as possible. So, rapid transport is something that we need to be on top of, and binding the pelvis together to limit the amount of space. Now, the reason why splinting a pelvis is so beneficial is when that pelvis opens, it allows for more space for blood to collect. If we bind the pelvis together, makes a much smaller space, so it'll tamponade quicker. Another thing is we don't want the pelvis to move while we're in transport. It's going to disrupt clots and cause a lot more hemorrhaging to occur internally. But if we bind the pelvis together and keep it stable, then it will not disrupt the clots. I do agree that yes, this patient's going to need oxygen. This patient will need blood. This patient will need TXA. A lot of things that we have to do for this patient specifically. But the best answer here is going to be splint the pelvis.